getting started with Medicare, okay? How do you qualify for Medicare or know if you qualify? You or your spouse qualify for Medicare Part A at no cost and Medicare Part B for a monthly premium if you worked 40 quarters, okay? Sometimes that's a little bit confusing for people. It's if you or your spouse worked 10 years. If you were a homemaker and didn't work, but your spouse did, you can draw your Medicare benefits off the fact that they paid federal income tax, okay? Now, Medicare, if you qualify, is going to start on the first day of your 65th birth month. If you turn 65 on the first day of a month, you're gonna get a bonus month. Medicare is gonna actually give you your Medicare a month early. So if you were born on September 1st, you're going to get your Medicare on August 1st. Now, what I also wanna bring up here, anyone that is currently enrolled or drawing Social Security benefits does not need to do anything. You are automatically going to be enrolled in Medicare. They'll send you all your information. They're going to deduct your premium directly from your Social Security check every month, okay? Now, if you are not drawing Social Security, you can enroll in Medicare 3 months prior to your 65th birth month, the month of, and 3 additional months after, okay? This is super important. If you don't enroll by the end of that 3rd month, you will be locked out of Medicare and they're gonna charge you a pretty hefty penalty when you have a chance to enroll again, okay? So make sure you do that enrollment in a timely fashion. Now, how do you enroll? There is 4 ways to enroll. You can mail in an application. You can do it over the phone. You can do it in person, or you can do it online. Now, the first 3 ways I wouldn't recommend. I wouldn't recommend sending in a paper application. Calling over the phone, you're gonna wait on hold for a couple hours. Then they're gonna call you back 6 to 8 weeks later to do your enrollment, just very time-consuming. Going into the office, wouldn't recommend doing that as well. You may not get to meet with one, it's a long wait. The easiest way to enroll in Medicare, and I want everyone to write this down, is to create an account on ssa.gov. There's a wealth of knowledge on ssa.gov anyways. You can see how much your retirement benefits are, when you can retire. It's a wonderful website that everyone should have an enrollment in. When you do that online registration, you can do your Medicare application from there. It takes 10 minutes. Me or my team can help you set that up and do that application. Very easy process, and we'll help you do that as well, okay? Now, how much does Medicare cost? Medicare Part A has no premium. Medicare Part B, for 2025, the standard premium is $185 per month. Now, that amount could be affected by your income, okay? That's why I have below here this fancy term, it's called IRMA, income-related monthly adjustment amount. If your income is above $106,000 if you file single, or $212,000 if you file jointly, they will charge you more for your Medicare Part B premium, okay? They're going to base that on your modified adjusted gross income from 2 years back. So in 2025, they're gonna base that on your 2023 federal tax return, okay? It's line 11 on your tax return. So if anyone wants to look at that number, again, write all that information down. Part of our Medicare cost breakdown for you, if you set up that one-on-one consultation, we'll have all of this information for you, okay? Now, how do you pay? If you're drawing Social Security, the premium's automatically going to come out of your Social Security. If you're not, you're going to be billed quarterly for your Part B premium. Now, if you want to set up an auto pay, or a reoccurring payment, or pay on a credit card or out of a health savings account that you've had all those years, you can write down another website, mymedicare.gov. Now, that's a wonderful site that you should also have access to, that's going to give you information on all the plans available, prescription drugs, preventative care. You can track your claims there, but you can also pay your premiums. You can set up a reoccurring account out of a credit card or out of a checking account, or you just can go and make manual payments from there. Now, what if you plan to continue working post 65? It's a big question that a lot of people have. Well, Medicare says if you or your spouse are working and currently on employer-sponsored drug coverage, you can defer your Medicare until you stop working. You'll have a 7-month window to do so to enroll in Medicare. It will be just like you were enrolling as if you were 65. Now, Medicare has a few restrictions on this. If you are working and you work for an employer who has less than 20 employees, you are required to enroll in Medicare Part B. Now, if you want to stay on your employer-sponsored coverage or go on Medicare is a very important decision. There are a ton of factors that you should consider. Those factors of if you should stay on your employer-sponsored group coverage or go on Medicare come down to what is the premium that you're paying each month out of your check for your Medicare plan. Is your spouse on the plan? Is that affecting the premium that you're paying each month? What are your deductibles? What are your co-pays? Are you having a hard time using the doctors that you want to on your current plan, having a hard time getting prescription coverage? Those are all factors that you really want to look at. That's something that me and my team will break down for you in that one-on-one consultation, showing the cost of what a Medicare plan would cost versus what your current coverage has. Now, again, if you decide to continue on your employer-sponsored coverage, then when you stop working, you will have a 7-month window to enroll in Medicare. There's 2 forms that you have to fill out and submit to Social Security. All this information is information that we can get for you and help you do once you decide to stop working.